Good morning, everybody. I'm Kerry Langford. I am the ACT Manager at National Disability Services. I welcome you all to our webinar this morning, Working Towards COVID Normal, when a WorkSafe ACT Inspector calls. I would like to begin today with acknowledgement of country. I would like to acknowledge the traditional custodians of country throughout Australia and recognise their continuing connection to land, waters and culture. I pay my respects to their elders past, present and emerging. So I am now going to, without further ado, introduce Jackie. So Jackie is the Acting Senior Director of Strategy, Occupational Hygiene at WorkSafe ACT. Jackie's a work health and safety inspector and a member of the Australasian College of Toxicology, Risk Assessment, the Australian Institute of Occupational Hygienists and the Faculty of Asbestos Management Australia and New Zealand. Wow. She has a postgraduate qualification in public health, epidemiology and biostatistics and has trained as a regulatory toxicologist. Jackie, thank you so much for joining us today. And I know that everybody's really looking forward to your presentation. So without further ado, I'm going to hand over to you.
Thank you, Kerry. I hope you can all see and hear me because I'm sharing my screen. All I can see is our slideshow. So as Kerry said, I'm Jackie. I'm from WorkSafe ACT. And what we're going to talk about today is about working towards COVID normal. So the ACT is working towards reopening and releasing restrictions and working out what COVID normal looks like. For National Disability Services, there are some very specific things that we're going to have a chat about, and we're going to talk about your duties, how you might go about them, and what an inspection actually looks like. So WorkSafe ACT, we are here in Canberra, based in Civic. Under the Work Health and Safety Act, the Work Health and Safety Commissioner, Jacqueline Aegis, lovely lady, is the regulator for work health and safety, workers' compensation and labour hire licensing. We're an independent entity in that we also regulate the ACT government. So we're not connected to the government to make sure that we can complete our regulatory functions. So we do a number of things. We provide information, advice and support. We provide education. We do a lot of engagement with the community. We also, of course, do our compliance and enforcement activities. Our aim is for a safe, fair and productive working lives for all Canberrans. And we do that under a number of acts and regulations. So it's not just the Work Health and Safety Act and regulation. We've also got dangerous substances and dangerous goods, scaffolding and lifts, machinery, dangerous substances. We get to do all the fireworks licensing, the Labour Hire Licensing Act and the Workers' Compensation Act. So when we look at the primary duty under the Work Health and Safety laws, it's about providing a workplace that is free from risks to health and safety for workers and for others. So those duty holders need to eliminate those risks where they can, and where they can't, they must minimise them so far as reasonably practicable. When we think about COVID-19, COVID-19 is a biological hazard under the Work Health and Safety laws. We have other examples of infectious diseases that are covered under the laws, and COVID-19 is no different. So part of complying with this requirement is staying up to date. So we know that with Work Health and Safety, there's actually a lot of crossover and a lot of different frameworks when you're a business that you need to comply with. It's not just work health and safety. You might have privacy, industrial relations, things like that. So to be able to comply fully as a business when it comes to COVID-19, we also have to make sure that there's compliance with the public health directions. So for disability services, that goes around vaccinations, which we're going to talk about. COVID safety plans, so every workplace must have a COVID safety plan. The use of personal protective equipment, which for the ACT, most of that seems to come from the Commonwealth Department of Health, who provides some really good guidance, and also around isolation and quarantining procedures when there is an exposure. So as I said, we've got the primary duty of care. So protecting workers and others at the workplace is your primary duty of care. And you do that by either eliminating or managing the risk. So managing the risk is around using the hierarchy of controls. And again, it's no different for a COVID-19 safety plan. The key thing I think that we have certainly found coming out of lockdown and as businesses are re-emerging into workplaces is that the COVID-19 safety plan is not the only part of a safe work system. It is only part of it. The COVID safety plan will certainly be a key part of it as we're coming out, but you need to actually put in place control measures that manage all of the risks at the workplace and integrate COVID-19 as a part of that. To do that, it's not an easy, simple sort of approach. It is a complex approach and it's informed by your risk assessments. So when you were looking at COVID-19, you need to integrate the advice and the requirements of the departments of health. So what's in the public health directions, what kind of guidance is available, the type of PPE you need to use. And particularly for disability services, you might need to do a risk assessment specific to each workplace. From what I understand, from what Kerry and Susan have told me, is there are such a wide range of workplaces that are covered under disability services. We can have the really high level face-to-face support down to the supported independent living, and also where maybe there is an early intervention for a newly diagnosed disability. So implementing a COVID-19 safety plan, you may actually have to look at each and every workplace that you have, who is there, what those risks look like, and apply controls specific for that workplace. So examples that you can use in the hierarchy of control I've got up there. So elimination, we know we can't eliminate COVID-19 at the moment, unfortunately, but we can eliminate some of the risk in that we can remove or restrict people with symptoms from entering the workplace. An isolation control, that goes around the density and the physical distancing. So isolation is about removing the risk and making a space in between it. So our quarantining and isolation procedures are part of that, but we also need to make sure we look at that physical distancing. We can substitute, so we can change procedures and processes to minimise the risk. We can add in engineering controls. So there's a lot of work being done around ventilation, but we also have our cleaning processes and our vaccinations. So those are actually physical things that we can use to minimise the risk. Once we've implemented those higher level controls, it is only then where a risk still remains that administrative controls are applied. We do have some mandatory ones, such as the QR sign-ins, but as a workplace, you can also look at rosters, infection control policies, and signage. And that signage can either be around removal or restriction, or that signage can also be around this is the policy at this workplace and you must comply with it. And then again, where there is still a risk that remains, that's when we look at personal protective equipment to support those other controls. So masks, gloves, face shields, and gowns. The other thing that we have absolutely seen as a regulator coming out of lockdown is around the psychosocial hazards of COVID-19. So the psychosocial hazards, excuse me, around COVID-19 can be anxieties about the virus itself, or they can also be around like coming back to work. So some of the common hazards are they're very clear as we're coming back into work, because of COVID has made such a big change to how we live and do things. So we're seeing more issues around job control, overload, support, isolated and remote work. You might have part of your workforce who are working from home full time, and that can be really difficult to do on a long-term period, even on a short-term period. Of course, these hazards then turn into quite observable behaviours around bullying, aggression, and exposure to traumatic events. And that can, of course, we've got stress, fatigue, burnout. When we're looking at psychological injuries and illness, we want to look at a preventative phase. So incorporating a review of the psychological hazards in a new risk assessment is really important. The other really, really big thing as we're coming back into the workplace is consultation. So once you've done a risk assessment, you've got a draft risk assessment there, you think you've got your control measures in place, this is where you go and you consult with your workers. And the questions that you're asking your workers are not emotional questions about how are you feeling. They are objective questions about, will this combination of control measures work to do your task? An example of that, of course, might be if you are head to toe in PPE and gloves, can you actually perform the service that you need to without tripping over something, ripping something, or being unable to actually complete that task? The other questions are around whether or not the control measures that you're putting in place add any additional risk. So as we're coming into summer in Canberra, is wearing a huge load of PPE actually then going to put that worker at risk of heat stress, for example? The other questions are around comparability. So when you put in place your control measures and you have a small workplace, are those control measures a little bit over the top, or are they comparable to the risk and the task that you are undertaking at that workplace? Again, always refer to the most recent public health guidance, and during your consultation, there are definitely going to be control measures that you need to put in place that are mandatory. So being able to communicate that to your workers and have an understanding of how they are going to manage that is very important as the PCBU. And then, of course, induction, training and supervision. As a regulator, we see some really great induction processes. We see some wonderful training, and then we don't actually see the supervision. Administrative controls and PPE are reliant on worker behaviour. So supervision after you've done induction and training is really important to make sure that your workers are doing everything they are supposed to stay safe. It's also going to help you to see whether or not what you've implemented actually works. So, WorkSafe ACT inspectors. We are quite a small regulator. Of course, ACT is quite small. We have about 30 inspectors. The inspectors are out 7 days a week conducting inspections. Our inspections generally come from two pathways, one being reactive when we get a notifiable incident, an inquiry or a complaint. So we might go out to a workplace based on those, or our proactive campaigns. And these are our scheduled campaigns. Sometimes we do what's called a saturation campaign, where all of the inspectors will go out on one day to do an inspection in a certain suburb or for a certain industry. When an inspector comes, the inspector will be talking with, of course, the PCBU. We'll identify who that is and try our absolute best to get in contact with them to have them there on site with us. The health and safety representatives, if there are any, and we also talk to the workers. When we're there, we're going to ask about workers' compensation, about labour hire licensing. We're going to ask how you do things, why you do things, and we're also going to ask to see documentation around risk assessment, policies, training, and anything else that's relevant for the task that you undertake. When an inspector is there, we might take notes, we might take photographs, we might ask for more information to be given to us after the inspection. We may issue on-the-spot notices, and I'll talk about what they might be, and we might schedule a follow-up visit. So when we come in for an inspection, our first step is gathering information. This will both be the inspector observing and gathering reasonable evidence, as well as talking to people who are there. So the biggest things we're looking for are what are the hazards and what risks do they pose? Once we've identified that, we then gather more information about the risk assessments and the control measures that are put in place at that workplace and understand how they work together and how they are applied. From that, we do a gap analysis. So that's where we actually compare what is being done at the workplace with the work health and safety laws or any of those other acts that we have, depending on what workplace you're at. And we look at the primary duty of care, and we look at reasonably practicable. So this is a really big thought process, and we might ask a lot of questions of the PCBU to really understand the reasonably practicable and how that applies at the workplace. We may then issue an enforcement notice. We will absolutely do a workplace visit report. So every visit, we will issue a report to the PCBU. So the enforcement notices we have at hand are improvement notices, prohibition notices, and infringements. So our improvement notices are nothing to be afraid of. They are there to help you do a little bit better. They're nothing that is going to, put a black mark against your name or against your workplace. They're just there to help you to do better. They will be very detailed around why you are getting an improvement notice, and they will also give recommendations about how you can comply with that improvement notice. And they will also have a time limit on when you are to implement that change. Prohibition notices are generally issued on the spot for highly hazardous work. So that is where the inspector will actually stop work at that workplace or stop a task at that workplace because it is very, very dangerous. An infringement notice is actually where we issue a fine. They will generally not be on the spot. They will generally come afterwards, but that's where you will be issued with a fine for your dangerous work. So after we've issued that workplace visit and whether or not there are any notices, we do a little bit more analysis. So we will probably review any paperwork or documentation that you provided to us, just to make sure that everything's all kosher. And then we have our verification and follow-up. So that could be a phone call, that could be a follow-up inspection, that could be a request for a photograph to show that you have implemented any recommendations from a notice. It is a very cyclical, as I've tried to sort of show on this slide. An inspection, we're not out there to pin you. We're actually out there to try and make sure that everyone is safe. Any of the fines or infringement notices we don't get to keep. They all go into the ACT government bank. So when we're out there also, we're not out there trying to meet any KPIs or any dollar signs that's requested. We are purely out there for safety reasons. When it comes to COVID-19, we do have authorisation under the public health directions. So we can stop work and we can issue fines on the spot for a COVID infraction as well. We have not yet used that because we think it's a little bit hard, to be honest. Everyone is absolutely trying their best. In Canberra, we're doing really, really well, and there aren't any people out there who are maliciously doing the wrong thing. But that sort of wraps up my presentation. I'm hoping we've got lots of questions. Questions, concerns, queries. If you see something that's not quite right, we can contact us by phone 24/7. You can email us. You can also report a concern or a notifiable incident on our webpage. We do have the ability to take any communication confidentially. Sometimes, particularly around psychosocial hazards, there is a real sensitivity around having to identify oneself. So please don't be afraid to reach out to us. All of the inspectors are absolutely wonderful and we are here to help.